Okay, we'll go ahead and get started. For those of you just joining us today, my name is Leanne Foster, and I am a member of the Provider Outreach and Education team at WPS. I'd like to welcome you all today to our SNF Revalidation Demystified, Your Top Questions Answered. This is a series that we've been doing monthly as we go through the SNF revalidation process to keep you up to date on changes and answer those questions. Today we will be taking pre-submitted questions. Some of you did submit those for us, and I thank you for that. I'm also going to be checking in with our PE representatives. We have Adrian Lopez and Jamie Rortvet with us today. I will be checking with them to help answer those questions, but I'm also going to be checking in with Aline in the chat for any live questions that you have. So certainly feel free to throw your questions into the chat. We want to make sure that we get those answered for you. Go ahead and throw them in as you have them. We will get to those. If for some reason we do have more questions than time allows, I will be creating a follow-up document and sending that out to all attendees today again so that we make sure that you have all your questions answered. So that brings me to our agenda for today. As I said, today is a question and answer session, and the goal is to provide you with a better understanding of the skilled nursing facility revalidation effort and any questions that you have regarding that. So we are going to do a couple of things today. We are going to talk through some where we currently are and give you any updates that we have on the CMS SNF revalidation effort. We're also going to give you a listing of some resources. Those have been provided in the training material today. But the bulk of our session, we are going to be answering your questions, both those pre-submitted and live questions that you ask here. So if you didn't submit a question ahead of time, that is perfectly okay. If you think of something during the session, throw that in the chat. Also, I do want to call out that we do have certain legal disclaimers that are at the end of this presentation. If you'd like to look at those are going to be on the end of your session. I will be using some acronyms today. I've often said that Medicare could use a Medicare to English dictionary sometimes. So I've included a slide that does have the acronyms I'll be using today. So if you need that, you do have that. But first, I'm going to start with an overview of the SNF revalidation process and what the intent of this is. So first and foremost, the SNF revalidation process, or the revalidation process as a whole, whether you're a SNF or another type of provider, this is a fraud prevention tool utilized by CMS. And one of the things that this revalidation process verifies is ownership information. And that ownership information is an extremely important fraud prevention tool that CMS uses. And so the CMS 855A changed in the fall. The reason for this is that CMS looked at the information we were currently gathering for SNF facilities and determined a need to expand the reporting for that ownership control. So SNFs have been required to report ownership and managing control information for a long time. Previously, they've done so in Section 5 and 6, just like any other supplier or provider. However, as I said, the CMS 855A changed late last year, and there is now the 924 version of that. This changes how SNFs are going to report that expanded ownership, and instead of reporting that in Section 5 and 6, SNFs will now report that expanded ownership in the new Attachment 1 that was created on that application. Now, I keep saying expanded ownership. So in addition to the typical ownership and managing control information, CMS is now requiring what's referred to as information regarding additional disclosable parties. And we're going to talk about what that is in a minute. But this expanded ownership has actually been part of the Code of Federal Regulations for quite some time, as far back as the beginning of the ACA. But CMS did not implement it on the form because they were working with various entities and looking for public feedback on the information that was provided, just to make sure, because this was going to be a big change, they wanted to make sure that it was gathering all of the information that was necessary. So Again, late last year, they updated that form, and in October of 24, they began sending out letters to providers, letting them know that they needed to submit a CMS 855A to satisfy what is referred to as an off-cycle revalidation. Now, the revalidation process is something that typically happens every 5 years, but CMS does reserve the right to activate an off-cycle revalidation for various reasons. In this case, because this was such a significant change to the CMS 855A, CMS coordinated with MACs to request that. So what does this mean? It does mean that letters were sent to all active SNF enrollments, and in those letters they did have a due date. The due date in those letters is no longer the due date for the providers. Currently, the due date is January 1st of 2026. We've not been made aware of any official change to that due date, but the due date at this time is January 1st of 2026. If that were to change as we approach that date, that is something that CMS and MACs will communicate. But if a revalidation is not submitted by that due date, it could result in payment interruption for the SNF providers. And that is not our goal. That is not something that CMS is hoping for. So we're offering these sessions to help you get those answers to your questions and get those revalidations submitted sooner rather than later to avoid those delays. So as I said, CMS is asking in that CMS 855A for expanded ownership and managing control and ADP information. So as I said, like with all other facilities, SNFs have been required to report that, and they've done so in Section 5.6. They will no longer do that in Section 5 or 6. They do need to do that, as I mentioned, in the Attachment 1 of the CMS 855A. An important call out here is that the sections are not interchangeable. If a SNF reports their ownership information, whether they're revalidating, whether they're an initial enrollment, or they're a change, the information in Section 5 and 6 cannot be accepted. That information does need to be in the new attachment. And that is because it's asking for a lot of the same things. So it's asking for the name, the tax ID, if it's an entity, the social security number, date of birth, but it's also asking about their role with that SNF, and we'll get to that in just a minute. But in the SNF disclosure, what are we looking for? We get these questions a lot. We are looking for all governing body members of that SNF, so all owners, all managing control. We're looking for all officers or directors, and we see that a lot with the nonprofit SNFs where they are governed by a board, they don't have owners. We're looking for the officers and the board of directors that are governing that SNF. And again, it's that fraud prevention tool. It's about who's going to have oversight and direct that SNF and all things that are going to impact the Medicare Trust Fund. Additionally, we do need to have all partners listed. We do need to have all trustees, and there's been some changes here where it was a percentage or a limited partnership or limited trustee. We do need all partners and all trustees, and that is a change. We also need all managing employees. That is something that we have needed for some time. There's not really a change there. I also mentioned the change in percentages. So if the SNF is a limited liability company or corporation, an LLC, it at one time was less, we only needed those with more than 5%. Less than 5% did not need to be reported. That has changed for SNF ownership reporting. If that SNF is an LLC, we do need all of the owners of that LLC, regardless of that percentage. And I will be showing you a document that goes into that in a little bit more detail. Then we're also needing all of the ADPs of a SNF, and this is an additional disclosable party. And we'll go through what that definition is here in just a minute. But when we're asking for ADPs, we're asking for ownership. We are looking for any individuals. We are looking for organizations. And with ADPs, we're looking for their organizational structure and their relationship to the SNF. So as I mentioned, we want to define what that ADP is. So ADP, again, is that additional disclosable party, and that ADP is defined in the Code of Federal Regulations 424.502, and I have included a link to that in the training material today if you would like to take a look at that. But an ADP is someone who is exercising control and has that oversight over that SNF. They're also someone who could be providing policies or procedures for that SNF. They could also be providing cash management services or have a real property interest in their real estate. So this is where we run into some gray area. It's not one way or the other. It's not based on title, it's really based on those services. So that can get a little confusing about how to identify an ADP. Today I'm going to give you some tips on how to identify that. The first is going to be checking that sub-regulatory guidance, which is the link here in the training material. I'm going to go directly out to the CMS website. From here, you will access the Medicare dropdown, and you will go into enrollment and renewal, and you will go into providers and suppliers. And from here, you're going to go to Medicare enrollment for providers and suppliers. And this is really a home page for provider enrollment from CMS. And the sub-regulatory guidance that they have issued, in addition to the instructions that are included in the CMS 855A, are under the news and additional resources section. So I'm going to scroll down. Okay, and here CMS has actually published that they are indefinitely suspending that January 1st, 2026. You do still need to submit that revalidation, but at this time there is not a set due date. This is something, again, that once it is set, CMS will communicate that. They are asking you to still submit those applications, and here is the link to the PDF with the sub-regulatory guidance. Yep, looks like it was just updated, and then it would have been published today. So that information has been updated. That is in the sub-regulatory guidance. That is a very recent change, and you will be seeing communications about that. So as far as defining an ADP, this has a set of instructions for what data must be furnished. So here it's talking about, we mentioned the governing bodies, all of the owners of the LLC, but there's also an item for all ADPs, and this defines that ADP. As I said, it's someone who is providing those policies and procedures. They're exercising some type of cash management or financial control, and then they're leasing or subleasing real property to the SNF. So this is really what it's about. It's not about a title. It is about whether or not the entity or individual is providing these services for you. So this is something that you do want to be aware of and leverage because it really will help you. There's also some FAQs in it. We get this question all the time about does this entity, does this individual, this type of individual, this type of entity qualify as an ADP? There are steps for defining that. One is obviously going to be, as I just said, going to that sub-regulatory guidance. The other is to contact your MAC, provide them with the information, and they can assist you with making that determination. The other is that CMS has created a mailbox where you can actually ask them specifically if your scenario, if your entity or individual qualifies as that ADP. So next we're going to go into some links and resources that we have. So I have included a link to the sub-regulatory guidance. I've also included the a link to, give me a second while that goes. It's thinking about it. This is information that we have on our website that goes through that attachment 1 and talks about what information must be provided. In addition to that, we do have a link to the CMS 855A, and then we also have a resource that is specific to nursing facility revalidations. A couple of things that I want to show you, and I'm actually going to navigate it from our website. if you go to our WPS website, in our training center, we have a specialty service and training resources section. And if you scroll down, you are going to see skilled nursing facility revalidations, and this links you to all of the resources that we have available for the skilled nursing facility revalidation effort. And the one that I want to show you before we move into questions is going to be the matrix, which is the second one here. This is also a resource that goes through the attachment 1, but it does break it down. Instead of by section, it breaks it down by field and tells you whether or not the field is required and if there's any exceptions or any other questions that you need to ask yourself. So this is also a good resource. Something else that we're excited about is that provider enrollment is offering one-on-one assistance for your questions with your revalidation application. So this is another resource that you have. I have asked Lean to throw a link to the chat for the mailbox where you can request that. So you will submit an email asking for a one-on-one session. Please, in the subject line, I would recommend that you put SNF Revalidation or SNF one-on-one, just so that it sticks out a little bit, but the staff are looking at that and they will get that directed to a representative from provider enrollment. And this is going to allow you to work directly with provider enrollment staff to get that revalidation submitted. Again, we're asking for a lot of information. CMS is aware of that, and WPS is doing everything they can to help assist you with that. All right, so that brings us to our question and answer session. So the first question is, how detailed should we be with our ADP reporting? So you do need to report anybody either that has direct ownership, indirect ownership, managing control, or any ADP that is providing those services that we just discussed. And this is a question that we get often. There is actually some information on the application. There are some questions that will actually help you more readily identify those ADPs. So I'm just going to go into CMS's website, and I'm going to pull up the Paper 855A form. Now, this is going to be the case even if you're submitting electronically. Certainly, we do encourage you to do so. So I'm going to go into, for a visual, the CMS 855A. And the attachment, I believe, starts. Yep. So I am in the attachment. I went a little further. I apologize for the scrolling. The attachment has instructions on pages 53 and 54, and this has a lot of good information that's also in that sub-regulatory guidance that's defining the entities that need to be reported, including the additional disclosable parties. And there are two sections to this attachment. There is the organization identification information and the individual identification information. So I apologize, I am going to be doing some scrolling here. When you are in this section, when you get, for the organizations, when you get to question 14, before you answer question 14, there is a section that has some additional instruction for you, and there is a note. And it's talking specifically about ADP, and it's telling you that if you answered yes to questions 9 through 13, your entity is an ADP and needs to be reported or needs to answer these questions. So that is going to be one of the other things that you're going to want to leverage in determining whether or not an entity or individual has to be reported. This is for the entity. We do have the same thing for the individual. Again, I'm going to be scrolling, so I apologize for that. All right, so we went past the individual questions, and this is when you start seeing questions when you get to 17. Oh, wait a minute. Sorry. Yeah, I did. When you get to question 17, I'll just make sure I'm in the right spot, there is that same note. It is a different set of questions in this case. It's asking about this is for individuals, and it's asking if, or telling you if you answered yes to questions 10 through 15, that individual is an ADP and does need to answer those ADP questions. So that will also help you identify an ADP. And as I said, that's a gray area. It's not specific to title. It's about the services that they provide. And with that, Adrian, I am going to hand it off to you for the next question.
Okay, our next question is regarding the organizational chart, and it states, is there a fill-in template available we can use for the org chart? I'll go ahead and share my screen. We don't have a template, but we do have a org chart example on our website. It's going to take a minute to connect. I still see it spinning.
Adrian, what I can do is nope, there you are, it just came
There
through.
we go. Wonderful. All right. So on our website, wpsgha.com, you will see this banner on the front page that has a nice skilled nursing facility revalidation countdown, which tells you there's 22 days remaining. If you click the click for more info button, takes you choose your MAC jurisdiction. I'll go with Part AJ5. And there are different facility resources here. And there are two org chart examples. First one's organizational flow charts. The second one we're looking for is the skilled nursing facility organizational charts. And this will bring up the article that tells you the 3 org charts that CMS is looking for when submitting the revalidation application. And that first chart is going to be all the organizations that are listed on the attachment 1, what was previously section 5, and that includes those organizational ADPs and also the skilled nursing facility itself. And the organizational owners are listed on page 55 of the paper application. This is going to be your chain home offices, your managing organizations, any other entities with an EIN that has a relationship to the skilled nursing facility, whether they're an ADP or not. If they're listed on your application, they're going to be listed on this first org chart. And on web, they're listed under organizations with ownership interest and or managing control and or additional disclosable party. And your second chart is going to identify the organizational structures of all the skilled nursing facilities owners, including owners that are not listed on the skilled nursing facility attachment. So based on if your skilled nursing facility is an LLC or a corporation or a local government, there are different disclosure requirements, and they have different levels of ownership that need to be reported. If you are a corporation, that if your SNF is a corporation, you only need to report the 5% or greater direct or indirect owners on your application, but every owner, including the ultimate parent owner, needs to be listed on your org chart. And that includes entities and individuals that are owners. And the individual owners are listed on page 65 of the paper application. And on the web, these are listed as individuals with ownership interests and or managing control and or additional disclosable party. So charts 1 and 2 could be combined into a single chart with all of your ownership, all of your managing employee information, managing org information, and make as much information as possible there to let us know what the relationship is to the skilled nursing facility. And your third chart is going to be regarding the ADPs that Leanne was going over. And this will outline the organizational structures of each ADP and the relationship with the skilled nursing facility. However, only organizational and individual owners that fall within the organizational structure definition need to be reported on this chart. For example, a corporation would list as 5% or greater direct or indirect owners, but not as board members if they are not owners. And that's regarding to the individuals. So we're looking for the individuals that have ownership of the ADP and the organizations that have ownership of the ADP. And that would be your third chart. And again, this must include a written description of the relationship of each ADP to the facility, meaning the skilled nursing facility, and to all the SNF's other ADPs, if they have a relationship to each other. And this third chart must remain separate. And there is a graphical outline that tells you what it might look like when you're submitting charts 1 and 2. we're not really looking forward to a specific outline of how these things appear on a page. We just want to make sure that everything is labeled so that we can understand what we're looking at. If you don't have a nice web like this, that's fine. We just want to make sure everything is separated and labeled as the owners, the SNF, the relationships, etc. That's charts 1 and 2 combined. And then the third chart, which is the ADP chart. And a nice key here, your skilled nursing facility, your ADPs, relationship to the SNF, and then those ADP owners. All right, I will stop sharing and stick it back to Leanne.
Leanne, we see your screen, but we're not able to hear you. Are you on mute by chance?
Can you hear me now?
Yes, ma'am.
Okay, thank you. Sorry, all. So the next question is asking about reporting ADPs, owners, board members, what is required. And we've talked about this a little bit. It is going to be all of those governing bodies. We get this question a lot with the boards, but it is all of the governing bodies. And then I'm coming back to the CMS 855A because you are going to need the information that is being requested in the CMS 855A. The other thing that I want to take you back to is that matrix, and this will really help with that as far as when that information is required. Again, it takes you field by field through that. All right, and next question, Adrienne and Jamie.
I will go ahead and take that one. Leanne, hello everyone, this is Jamie Rortvedt. Sorry, I had to join a little late. But our next question we received was, we have returned our 855 with corrections, but not received a response except to note receipt. Nevertheless, I received emails indicating that we have not resubmitted the 855 with corrections. We have contacted WPS and they say it's with CMS. What does this mean? The response to this question is, without knowing the exact application in question, could mean various things, I guess is the best way to put this. The application, could have been received, and upon reviewing the documentation and whatnot received, it may have had to been sent to CMS for further review and approval of something, possibly approval of additional locations. If that is the case, there's various reasons that we may have had to send it on to CMS for additional review. Unfortunately, as I mentioned initially, without knowing the exact application information, it is very hard to give a direct answer on that one. So if whoever did request this question is part of the call, if you would like to add in chat your application information, we'd be more than happy to go ahead and review and do some research on that application for you. Thank you. Leanne, back to you.
Thank you, Jamie. I am going to respond to one question that just came into the chat. And Adrienne, I know you answered this in chat, but I don't know if everyone saw the question, so I just want to make sure of that. We did get a question that said, I heard that this was being delayed again, and that I mentioned CMS will make an announcement if delayed. When will we know by? And it's a great question. We do know this just changed this morning, so I apologize that it's not matching up with what's in the presentation. This is a very fluid situation. So what they have indicated is that the previous deadline of January 1st has been indefinitely suspended. That is on CMS's website. That is also in the sub-regulatory guidance here at the top. Now, as far as a new deadline. We do not have that information at this time. That'll be communicated as soon as CMS gives that to us. And then Adrian also added in the chat that we should have new guidelines regarding our applications that are in process, and those not yet submitted by the end of the month. But at this time, we are still waiting further direction from CMS, but we will certainly make sure that all of that information is released to you, the provider community, as soon as we possibly can, as soon as we have that. So please stay tuned. I know that's not necessarily the best answer. It's not a definitive answer, but again, as I said, this is a very fluid situation. The January 1st deadline is now in flux and it's indefinite, and stay tuned is where we are at this point. So the next question that I had was who to call with questions while working on the revalidation. And we do get this question a lot. It ties into Jamie's question a little bit if you're trying to identify the status of your application or if you get a development letter that comes in. So I am going to put some information into the chat. You would contact our customer service area, but I also want to encourage you to request those one-on-one sessions with provider enrollment staff, and that would go to that provider enrollment email address that we placed in the chat earlier. I'm going to go ahead and put that back into the chat. I apologize for the typing that you're probably hearing, but you can also request that one-on-one through that pe.medicare email address, again, to help you get your questions resolved and get those revalidations in. As I said, the deadline is currently indefinite. However, they are still encouraging providers to submit those revalidations. With that, Adrian and Jamie, back to you.
Sorry about that. It took me a minute to get off mute. All right, I believe the next question is regarding vendors. The question was, vendors information required? Are you able to share? Do you still have a share up for the subreg by any chance?
I can.
Okay.
And where would you like me to go, Adrian?
Well, we're just going to look for the word vendor because there is exactly one paragraph in the subreg regarding vendors. So if you look here under administrative services, that these can involve services such as but not limited to compliance and oversight, human resources, and public relations. And it does not include custodial building security or similar services, but it does include it also does not include EHR vendors, billing companies, or payroll vendors. And then it says basically like if they have some other additional role that would require disclosure to the skilled nursing. So if EHR also furnishes extensive financial services to the SNF, and likely this may be, the vendor would not qualify as an ADP for GSR specific services, but it would for its financial services. So as far as vendors go, it depends on what the relationship is to the skilled nursing facility. I know we've had a question before regarding durable medical equipment vendors, and those would not need to be reported on your SNF application since they were separately reported through Medicare, the DME benefit instead. So that's what the subreg says about vendors. If you have any further questions about that, we could always address that later on if you had anything about specific vendors, but we're looking for what the relationship is to the skilled nursing facility and where they should be reported and if they need to be reported based on what kind of services they provide. And back to Leanne.
All right, thank you, Adrian. I'm going to add one thing. This is not about vendors, but this is about staffing agencies. And I bring that up because we've gotten that question in the past as well, and just to make sure in case that is somehow involved. So on page 9 of that sub-regulatory guidance, we also have some information. It's about ADPs, but it talks specifically about certain staffing companies and other facilities that a SNF may contract with. And it talks about which ones are considered ADPs and which ones are not. As you can see here, it's listing things such as pharmacies, labs, podiatrists, those types of things are not considered an ADP. But the nursing staffing companies is where you may find a situation where they're considered an ADP. So like I said, not a vendor, but I thought this paired well with that question because we do get that question as well. So the next question that I have is asking for clarification on direct and indirect ownership. And this is where we start getting into the different levels of ownership. So direct ownership means that that entity or that individual has ownership in that enrolling provider, that's SNF. They could be, also could have direct ownership of another entity that's being reported on that application. Indirect ownership tends to happen where you have a parent company. So say you have an organization that has ownership in that SNF. The entities or individuals that own that parent organization have indirect ownership of that SNF. They may not own that SNF appropriately, but that company does. And so the people that own that parent company have an indirect ownership in that SNF. And this is where those organizational charts come in. They're helping us identify kind of that hierarchy of ownership and knowing what information we need to have on that application. And Adrian and Jamie, back to you.
Okay, hello again. So our next question is, all of my revalidations still say awaiting processing. I haven't received any more requests for changes. Is there something else I need to do, or do I just keep waiting for approval? Again, as the prior question earlier was, there's not a specific application identified with this question, so, hard to provide exact details. However, all of the SNF revalidation applications that we have received or requested information on, documentation, whatever it may be, because of the extended deadlines and things like that, are housed within our internal case management system in a pending location. That pending location, therefore, then displays in PACOS as awaiting processing. If your application has been in this status for, let's say, an extended period of time, and you haven't heard from the analyst who is specifically processing your application, I would highly recommend reaching out to that analyst directly if you have that information. Or of course, feel free to reach out to customer service for further details on that application so we can see what is going on with it. Most of the time it is because there is some missing information still required, but again, without knowing application specifics, it's hard to properly give a response on that. Leanne?
Thank you. And just to add to what Jamie said, that customer service email could help you get some more detail. Call in, they maybe have some information on that specific situation. So thank you, Jamie. And the next question is, what if the related party refuses to provide their information? So as I stated, we're asking for all the same information that we're asking for managing employees and ownership. So name, tax ID, social security number. We have seen situations though where those entities are not comfortable with providing that information. CMS has addressed that in the sub-regulatory guidance. I apologize for the scrolling. I just need to get to the page. There we go. So this is on page 19. So CMS is expecting SNFs to do everything that they can to try and obtain that information. And they call it feasible efforts. So they want to make sure that that data is getting secured and there's at least attempts being made. This is no different from today. We're asking for that information to be in section 5 and 6. However, they do recognize there's a point at which it may become the thing that's holding up that revalidation application. So you do have to make a few attempts. You can't just, one and done or just not make that attempt. But what CMS is recommending, if you really have exhausted all feasible methods of trying to obtain that information, is that you document your efforts thoroughly, and then that gets submitted with your revalidation application. So the things that could be in there would be, what information were you unable to get? Maybe you were able to get some of it, but not all of it. They want to know how, and I would also suggest, dates, things of that nature, but documentation of how that you attempted to obtain that information from that party that needs to be disclosed. We need to know who you're not able to get that information for, who's declining that. Again, the number of attempts, I mentioned that as well, and that's where those dates will come in. And then why there's nothing else that can be attempted, why all efforts have been exhausted. So you'll include that with the application. What that allows is for the MAC, it allows us to have communications with CMS and seek guidance on how to proceed. CMS will tell us whether or not we have what we need or if we need to take further efforts. And certainly there would be communication if there's more that we need the provider to do. So that is what CMS and MACs are recommending if you're unable to obtain all of that information. And the next question is back to Adrian and Jamie.
Thank you. The next question is regarding documentation requirements. So it does dovetail nicely with what we just discussed. So that email or a formal letter regarding your efforts to obtain the data should be included with your submission of the revalidation application if you've already tried to get information and haven't been successful. The org charts would be another documentation requirement that's required for all revalidation applications for skilled nursing facilities. And some other documentation that might be needed would be the CMS 588 form if your EFT, electronic funds transfer information is changing, if you changed your banks, if your banks has changed their names, if you need to change the address to your bank, if payments are being made to your chain home office now. That would be a reason to submit the 588 form. If you have any organizations who've had a name change as well, then we would need the IRS documentation that confirms the name change. If you've had any 50% or greater ownership changes and there was a stock transfer exchange there, we would need to have a documentation confirming that that new ownership. Those are just some of the examples. I believe there's also a list of them on the papers form when you're submitting your application at the very back of the paper form, and also when you're submitting via web, there's a list, a nice checkbox of things that you could submit, and that will tell you the different examples that you can upload when you're submitting them to PACOs. All right, back to you, Leanne.
All right, thank you. Next question is about the enrollment fee, and the question is asking if an enrollment fee is required for an off-cycle revalidation, and the answer to that is yes. It is still a revalidation, it's still part of that enrollment fee requirement, and that fee is paid through PACOs. Adrian, Jamie, back to you.
Sorry, couldn't find my mute button. Next question we received was ownership for nonprofit run by voluntary board of directors, and if those need to be reported or not. Yes, all of those board members would need to be reported in the individual section of the attachment 1, and that would be regardless of the corporate structure. So if it's, if it's 2 members, the 2 members need to go on there, which obviously is rather small, but, if there's 10, 15, 20 members, yes, all of them would need to be reported as well. Leanne?
Thank you. The next question is, do we still put any persons or entities in section 5 and 6 of 855A, or do all of the owners, managers, operators, et cetera, now get entered into the SNF attachment 1 along with the ADPs? It's a great question. We touched on this just a little bit, but this is a good clarification. SNFs will no longer use section 5 and 6, even outside of the revalidation. Any ownership or managing control or ADP information must be reported in attachment 1. And as I mentioned before, the sections are not interchangeable. So if you're a SNF and you provided that information, but you provided it in section 5, 6, and there's nothing in the attachment, MACs do need to develop to have that information completed in the attachment 1. Again, there's some similarities in the data, but there are different questions, and CMS is not allowing for MACs to take that information from 5 and 6 because we do need that attachment. So for SNFs, that is something that you just want to omit and you're not going to complete it. I also want to point out that in PACOs, if you're submitting the electronic one, it is going to be reported in the ownership and managing existing management and employee sections of PACOs. They haven't added an attachment 1 to PACOs. However, the questions in that ownership and managing control section do adjust to align with attachment 1 when the provider has selected the provider type of SNF. So it will look as, you'll see the questions, it'll look and feel as attachment 1 does on the paper application. It's just accessed through that same section. And they did that to streamline it until it was less confusing. They had a section, they just added those additional questions for that particular provider type. With that, back to Adrian and Jamie.
All right, our question is, how do I report ownership of an ADP? What if I don't have ownership? Do I report multiple organizational control to show the ADPs? The organizational structures will vary by the ADPs. You know, some of them do not have direct or indirect ownership. We must still report the owners if applicable and all managing controls for those organizations. Unlike the skilled nursing facility itself, there's no requirement to report the ultimate parent owner of an ADP. So we're really not looking to get too far into the weeds here. So, you know, if you've made the attempt to find out who their owners are, if any, or if they have any managing control and you weren't able to obtain that information, that letter that we mentioned previously is when you would be submitting that. As far as the ADP's information, when you're reporting it on the paper application, it may require, you know, certain sections to be reported multiple times until you get all the information in there that you do have available. But otherwise, you know, the ADPs will be disclosing based on their business structure, if they're a corporation, have owners direct and indirect, if they're an LLC, any ownership regardless of the percentage, and so on. And these are listed on the application itself to let you know how to report them. And back to Leanne.
All right, and this is the last pre-submitted question that we have, and I'll check in with Aline for any questions in the chat. The last question that we have is, do we have to include ownership percentages on the organizational charts? That information is captured on the application where it's needed, so there's not a need to put that percentage on that organizational chart. It's not a requirement. And again, Adrian went through those organizational charts and provided those examples. That'll be really helpful for that. So with that, I am going to check in with Aline just to see if we have any questions in the chat.
Hi, Leanne. Thanks you guys for all that great information. In scrolling through the chat, I do not see any questions that have not been addressed.
All right, thank you, Aline. So we will go ahead and wrap up then. A couple of things before we go. I do want to make everyone aware of the fact that it is our open enrollment for participation. So this is the time of the year if you're wanting to change your participation status, if you want to become a participating provider in 2026, now is the time. It is that annual time. It is something that you will want to look at that initial announcement, but it does require that a CMS 460 is submitted, and it will be for participation beginning of 2026. So that will need to be received also by the end of the year, so by December 31st for that participation status to be put in place. So if you're interested in a little more information on that, including the CMS 460 form that's required for that, there is a link to that in your training materials, and it includes where to submit that information. So in a few minutes, you are going to receive an email, and that email has a lot of things in it. First and foremost, it does have a link to our survey. Everything that we do in outreach and education is driven by you. We want to know what we're doing well for you, what we could do better, and what you would like to see in the future. So I would appreciate it if you would take a few minutes to provide us some feedback and take that survey. There's a couple of ways you can take that. I will be asking Aline to throw a link in the chat, and you can access it through that. You're also going to get a redirect as you leave this session. That's not malicious. That's not spam. It's not taking you anywhere you don't want to go. It's just letting you know that you're leaving our webinar software, and that link is going to take you into the CMS Qualtrics survey software, again, for you to provide us with some information. So again, thank you for taking some time to do that. Also, that email is going to serve as your certificate of achievement. If you attended today for any continuing education credits, well, we don't issue the credits, we do issue those certificates of achievement, and they can be they can be sent to your accreditation or certification body to count towards those continuing education hours. If you do not get that, one of two things happened. Either it went to your junk or your spam filter because our WebEx manager email is not on your safe senders list, or you attended by phone. If that's the case, go ahead and send an email to our WPS Education mailbox, and I'll verify your attendance. It just can't be done systematically without going through that mailbox, and then I'll get a certificate out to you so that you have that. I also want to point out that if you think of any follow-up questions, I am taking follow-up questions for the next 7 days. That can go, those requests or questions can go to that same education mailbox. Just throw something in there about SNF revalidation so that the team members that are managing that mailbox know to get that to me so that we can get those answers to you. With that, that does end our presentation for today. We look forward to hearing from you in our survey and in future education events. On behalf of myself, Aline, Jamie, and Adrian, I want to thank you all for taking the time to participate today. We're all super busy, and I know that hour can be kind of hard to carve out, so I hope you found this helpful. With that, that ends our session for today. I hope you have a great rest of your week and continue to be well. You may now disconnect.